I graduated nursing school with a 3.8 GPA and I never failed a class. And I'm going to teach you guys how I studied and passed med-surg. So your med-surg class is where you learn about all the basic diseases in nursing, how it would be diagnosed, and how you treat them for your patient. So there are 6 big things you want to go over every time you study, and this is going to make you pass your exams. Number 1, you always want to know the disease definition. For this video, I'm going to be using strokes as an example so that you guys can follow along with me. So by disease definition, you want to know what type of disease it is and what it's defined by. So for strokes, we know that there's 3 main types: a TIA, which is a transient ischemic attack, an ischemic stroke, and a hemorrhagic stroke. A TIA would be more like a mini brief stroke. An ischemic stroke means that there's lack of blood there, so it breaks down into embolic and thrombotic. And then your last type of stroke is a hemorrhagic stroke, which means that there's bleeding from a vessel and you're hemorrhaging blood. This all happens in the brain, by the way. So that was number 1, understanding the disease definition and if that disease breaks down into any category. Number 2, you always want to know your risk factors. Now in nursing, there's always going to be modifiable and non-modifiable risk factors. A modifiable risk factor is something you could change. So for stroke, it would be smoking or hypertension. These are the things that are going to be important for patient teaching. Now a non-modifiable risk factor will be something that the patient can't change about themselves. So age, gender, or family history. These are things that might leave the patient susceptible to the disease, but it's not really the patient's fault. So after you study risk factors, number 3 is always knowing the clinical manifestations. This is how the patient presents when they have this disease. So for example, a patient who has a stroke would present with slurred speech, difficulty swallowing, etc. But it's also important to study how clinical manifestations differ. What I mean by this is that there's different types of stroke. So people can have a stroke on the right side of their brain or the left side of the brain. Depending on where they have that stroke in the brain, their clinical manifestations or the way their symptoms look will be different. An example of this is if a patient has a stroke on their left side of the brain, they're going to present with things like aphasia and they're going to have right-sided hemiparesis. Whereas if a patient has a stroke on their right side of the brain, they're going to present with things like more impulsive behavior and they'll have left-sided hemiparesis. Hemiparesis is basically weakness or paralysis. So the right side of the brain will affect the left side of your body and the left side of the brain would affect the right side of your body. This is what I mean by it is important to study your clinical manifestations because they're always going to show up on your nursing exams. Number 4 is knowing how the disease will be diagnosed. So for a patient with a stroke, the diagnosis is going to be CT scan, which is usually number 1, but they also have things like neuro assessments, stroke assessments, anything you would use to diagnose that disease. Number 5, you want to know how you treat this disease, which I feel like also goes hand in hand with nursing interventions. So remember earlier when I was talking about the disease definition and knowing the different categories of it, this is when the treatments become very important. So for example, if a patient has an ischemic stroke, you would treat this with clot busters like TPA. Whereas if a patient has a hemorrhagic stroke, you would treat this with BP control, watching for intracranial pressure, and making sure to use no blood thinners. So it is very important in med-surg to know the different categories of a disease because although you might use a treatment like TPA for an ischemic stroke, if you use this on a patient with a hemorrhagic stroke, it can be very, very deadly. So always know your treatments and your nursing interventions for every disease. And finally, number 6 is patient teaching. If you don't know this already, one of the biggest things in nursing is patient teaching. We are constantly teaching our patients. So for a stroke, patient teaching would be telling your patient that it's easier to dress on the more weaker side. You would also tell their family or other people to approach them on their unaffected side. So remember how I said the stroke can either happen on the left side of the brain or the right side of the brain, and how the effects of it usually affect the opposite side of the body? You would always want to tell family members or other people to approach them from their unaffected side because that's their stronger side. So overall, when studying for med-surg, you want to know these 6 things and write them down. Disease definitions and if they break down into categories. Number 2, your risk factors, the modifiable ones and the non-modifiable ones. Number 3, your clinical manifestations, basically the symptoms that arise in these patients. Number 4, how you diagnose this disease. Number 5, your treatment and your nursing interventions. And finally, number 6, and one of the most important things in nursing, patient teaching. Now, if you get these 6 things down for every disease on your med-surg exams, you are going to pass those tests. Hope this helps. Bye, babes.